Good afternoon and welcome to the Multicultural Media Online Conference. It's wonderful to see you all again. I am your moderator, Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and on behalf of the Ministry of Health, Multicultural New South Wales and our service, thank you very much again for joining us. Today, we're so pleased to have with us New South Wales Health Senior Medical Advisor, Dr. Fizzell, of course, to provide key updates on COVID-19 and flu to our multicultural media, multicultural health workers, and community representatives who are with us online. We're so pleased to have joining us this afternoon, Dr. Valerie Delpech, Director of the Communicable Diseases Branch at Health Protection New South Wales. Dr. Valerie will provide us updates and information on monkeypox. We'd like to begin by acknowledging traditional owners of the land from which we're all meeting from today. We'd like to acknowledge the traditional custodians of the land of the Darug people of which I am joining from. We pay respect to elders past and present and extend that respect to Aboriginal elders and colleagues. We also acknowledge the elders from all multicultural groups represented at this online briefing. Thank you, as always, for keeping your microphones on mute. We do encourage you to please ask your questions and comments on the chat, and we'll do our best to answer them today. As always, we do want a lively discussion, so please share your thoughts with us. Throughout the session, my colleagues from the Multicultural Health Communication Service will be adding links on the chat for resources and information available in multiple languages and health initiatives on New South Wales Health and New South Wales government websites. It's now my pleasure to hand it over to Dr. Jan for an update on COVID-19, flu, and other public health matters. How are you, Dr. Jan?
Well, thank you, Jess, and good afternoon, everyone. This week, there's some promising news on the COVID front. It looks like we may have reached our peak of the BA.4/5 transmission. However, that does still mean that there's a fair few people who will be vulnerable in the coming weeks, because to get up to a peak, we also have to have the coming down. So it's important that we keep up to date with our COVID vaccinations, that we stay home if we're sick and get tested, that we make sure that we wear our mask when we're indoors with others, and of course, keep your hands clean as well, because it will help prevent other respiratory illnesses as well. The number of people with COVID in New South Wales who were hospitalised remains stable at 2,267 people at the end of the week ending the 30th of July. And we have had a decrease in the number of people admitted to ICU. There were 164 COVID-19 related deaths reported in the week ending the 30th of July 2022, and New South Wales Health extends our condolences to all of those families and loved ones. 6 deaths were in people aged under the age of 65 years, and just a reminder that deaths do not always occur in the week that they are reported. Sometimes there is a little bit of a delay. We still have the dominant strains BA.4 and 5 Omicron subvariants circulating, and they were up to 97% of the specimens sampled in the week ending the 30th of July. It is also important to know that children who have significant clinical problems such as immunosuppression, treatment for cancer, congenital heart disease, aged from 6 months to 5 years will become eligible for COVID-19 vaccination. And we'd really encourage parents of children with complex illnesses to talk to their GP about what might be suitable for them. Thank you.
Thank you so much, Dr. Jan, for that. As you said, that it's important to stay at home if you're unwell, and I am feeling a bit unwell, so I'm joining online. So thank you. Dr. Valerie Delpech, thank you so much for joining us. Do you have any updates for us on monkeypox?
Yes, absolutely. So I think probably the first thing, I'm not sure if the audience is familiar with monkeypox, but monkeypox is quite a different virus to COVID. Firstly, it's a DNA virus rather than an RNA virus. What actually that means, it probably replicates a lot slower. So we're not going to see the large mutations that we're seeing in COVID. Having said that, we're only just starting to learn. There's a lot of unknowns about this virus. It was much more common many decades ago before smallpox was eradicated. And the reason that monkeypox wasn't around during this time is that the smallpox and monkeypox viruses are extremely similar. So when we eradicated smallpox, as you know, across the whole globe, which was a major public health achievement, we also more or less eradicated monkeypox in humans. However, monkeypox is something that does occur in rodents, particularly in Central and Western Africa. And so we've been seeing a few cases of largely animal-acquired, or zoonotic, as we call it, acquired infections in that region of the world for trickling for a few decades. However, much more recently, since May, in fact, we've seen a global outbreak of monkeypox in other countries. And we're now up to the tens of thousands across the world. This outbreak is very different to what we're seeing in Central and Western Africa, in that it is very much an infection at the moment, primarily among gay and bisexual and other men who have sex with men. And it is really acquired through very close direct or sexual contact of a person who has monkeypox. Although there can be a prodromal, as we call, respiratory illness before developing a rash, that respiratory illness is probably not as anything as infectious as COVID, for instance. So transmissions through the respiratory route is probably minimal. And really what we're talking about here is an infection that is spread through close direct contact. Should I go on? Do you want some questions?
Yes, we do have some questions. Thank you so much for that. And you've just answered those questions about it spreading. But I guess the question is about the vaccination that's available for monkeypox, and who is being targeted for the vaccine?
And I guess the first thing to say, we're fortunate in New South Wales at the moment, although there are many cases across the world. Overall in Australia, there are a total of 60 odd cases at the moment, 69, I believe, of which there are 35 in New South Wales. And all of those have been acquired outside of New South Wales, and particularly people traveling to Europe. And these are all gay and bisexual men who report having had sexual contact with other men abroad. So this is not in the general population at this stage. However, there's no reason that people shouldn't be aware and understand about monkeypox, because it is something that can be acquired from direct skin-to-skin contact, as I say. So vaccination can provide very strong protection. There's been a number of vaccines that have been developed. And more recently, in this week, in fact, in New South Wales, we received the first dose of the third generation, which is a very safe vaccine indeed, which is originally a smallpox vaccine, but as I said, has very good effect in reducing acquisition and disease in people who acquire monkeypox. So the vaccine has only arrived in very small doses. As people will understand, globally, it's in high demand. It's only actually manufactured in one company in the world, and they're very, very busy trying to get the supplies that are required across the world. And we've received a small amount of doses here in New South Wales, and we're already the first state to start to implement and give the vaccine. So who should get the vaccine at the moment? It's very targeted to priority areas. And of course, as I've mentioned, because it is largely among gay, bisexual and other men who have sex with men, that is really the group who are sexually active, who may have a number of sexual partners, who may be sex workers, homeless, therefore more vulnerable to acquiring monkeypox should it become endemic in this state. They are really our priority groups. And it is also highly sexually active gay men who may be going abroad to those areas where monkeypox is also being reported. So at the moment, the strategy is very much targeting gay, bisexual and other men who have sex with men.
Thank you so much, Dr. Valerie. It's a really great information. It's really good to note that we are the first state to be able to share and make it available for priority populations. Dr. Jan, one of the questions that we've received here is about the vaccines, but also in terms of COVID-19. You know, we have monkeypox, we have COVID-19. Have we reached the peak for the wave of COVID-19, and what concerns should we have?
So I think the data is starting to show that we are we've probably hit that peak and we're starting to come down on the other side, but that still means that there's a lot of people who could yet catch COVID-19 as we do come down on that other side, and that people could still be hospitalised and get very sick. So it is still worthwhile getting out and getting that booster vaccine if you haven't had it yet, particularly if you're an adult who's over the age of 50 and haven't had that 4th winter dose. Really, really important. Available at pharmacies, available at GPs, a lot of walk-up appointments available. So really important to get that vaccination in. There's still enough COVID around to make it worthwhile.
Thank you, Dr. Jan. And for those joining us, thank you so much. If you have any questions, please add them to the chat. We'll also have some resources added with links for multicultural and multilingual resources. Dr. Jan, I guess we've received some questions about the safety of vaccinations of monkeypox and COVID-19 and flu. With these 3 vaccinations, is it safe to take them 3? Or that's a question that we've received from communities.
So I'm happy to take that one. I mean, there's not a lot of data. As you know, monkeypox vaccine rollout is very new. However, this 3rd generation vaccine is extremely safe. And at the moment, there's no reason why people should not have their vaccines at the same time. As I said, because it is very much prioritized at the moment, it wouldn't be something that you would get when you go and get your COVID vaccine. So at the moment, there are specific clinics and specific GPs who are giving out monkeypox, so it's not in the general community at all. We're working very closely with a lot of our community partners to ensure those who need it the most are able to access the vaccine.
Thank you, Dr. Valerie. Questions about how, the monkeypox and how serious this could get for people.
Yeah, so I mean, I think the good news is monkeypox is largely a self-limiting illness, which may begin with, as I said, a bit of a respiratory type infection with a runny nose, maybe a temperature, maybe a sore throat. And then there are vesicles that develop. In other words, there are skin lesions. They may start in the mouth and give some ulcers, but eventually they can spread throughout the body. If it's acquired through mostly sexually acquired, then those lesions are going to be in the genital area, and so they may be missed. But essentially, while those blisters, a bit like chickenpox, essentially, when those blisters are there and contain vesicles with fluid in them, they're highly infectious. And that's why the skin-to-skin contact is the most important transmission. Most people will heal their lesions over a couple of weeks. And once those lesions are healed and no longer visible, they're no longer infectious. And therefore, while you have monkeypox, you're asked to isolate at home and keep away and ensure, obviously, good hygiene. But essentially, when most people recover fully, the likelihood of complications is extremely low. And death rates at this stage have been extremely low. Where people are more susceptible is if they have already a reduced immune system, which would be the same for other infectious diseases. And they're the individuals who can have complications with monkeypox. But we haven't seen any such complications here in Australia.
Thank you so much, Dr. Valerie. And I guess the question about can you get, like, people who have had COVID but infected again with COVID, if you've had monkeypox, could you get it again?
Well, that's a good question. Because, again, whether you acquire a virus a number of times is whether or not the virus mutates. The mutation of monkeypox is far, far, far less than that of COVID. So it is unlikely. However, having said all that, this is the first time we're seeing monkeypox globally to this extent. And so as we collect more and more data and understand it more, and we'll be able to understand. So it may be that some people get it again, but that would be quite rare, I would imagine.
Thank you so much, Dr. Valerie. Dr. Jan, a question about antivirals. We'll be promoting this heavily to communities, that it is available to groups. Are there any evidence that it has been used and accessed by communities? And is there a need for us to continue promoting to vulnerable groups?
Absolutely. The PBS data is really promising, showing that we've had some of the highest uptake in Australia of these antiviral medications, which is really good news. But we do want to make sure that the message is really getting out to the community about their availability. So people over the age of 70 and people over the age of 50 with significant illnesses, so it could be heart disease and diabetes, could be obesity, lung disease, cancer, and younger people who are immunosuppressed either from birth and who are age 18 or over now, people who are having treatment for things like rheumatoid arthritis or ulcerative colitis, people who are having cancer therapies who are immunosuppressed, are all eligible for antiviral treatment. So those antivirals are available from a script from your GP. And also, if you're having trouble getting onto your GP, you can call the New South Wales Health COVID and Flu helpline, and they can help put you in touch with the GP. A lot of the GP respiratory clinics that you can find online, just Google GP respiratory clinics, often have appointments available on the same day, and that way you don't have to wait either. So really important though that if you are in those risk groups, those antivirals do decrease that risk of hospitalisation, even if you're immunised. We know that the immunisation is not perfect. It's much better than not being immunised, but it's another layer of safety that can help people. And so again, really encourage people to have that conversation with their GP or specialist when you next see them about how you could go about accessing antivirals if you do get COVID.
And Dr. Jan, a lot of people are, when they get tested for COVID, some delay in contacting their GPs if they're highly immunocompromised. It's important for them to contact them immediately so that they can access it.
Exactly. So if you get that rat test and you've done it, it's positive, or you get a result back that says you're a PCR, don't wait for New South Wales Health to reach out to you. Reach into your GP and get that script as soon as possible. If it's after hours, if it's a weekend and your GP is not available and you can't find another GP through looking at, say, the Hot Doc service or Googling the GP respiratory clinics, that New South Wales Health a COVID and flu helpline will connect you through to a GP who can get you an electronic script that gets sent to your phone. And then either a family member who's not a close contact, preferably, can get that script for you, and you can start it on that same day if possible. It's really important that you get started as soon as possible after those symptoms start. So that's why don't delay testing. If you think it could even possibly be COVID, do a test. PCR testing is available still in lots and lots of locations. But if you're in a rural location where the PCR tests are only a couple of times a week, don't hang out until it's PCR testing day. Either talk to your GP or use a rat test and get those results sooner rather than later.
Dr. Jan, you're asking, you just mentioned about the rat test and PCR tests. I guess the question from some of the communities are asking, should you be taking the rat or should you be taking the PCRs, because of some of them, the tests that come from the rat can be not as accurate.
Yeah, so the rat test is quite useful when it's positive. It really does mean that you've got COVID, and it's a good indication that, you know, you should be at home and isolating. The negative test results are a little bit less reliable. It takes longer for your rat test to become positive after you've been infected with COVID than it does for your PCR. And your rat test will go negative when, you know, you're mostly unlikely to be infectious, but still wouldn't trust it. I'd wait my 7 days before I went back out into the community, just like we're meant to do under the self-isolation order. If you are highly vulnerable and you're sick, you've got symptoms that could be COVID, the reason why we're encouraging people to get that PCR test is that they are that bit more accurate. And so you're less likely to have one of those episodes where my rat didn't go positive, but my PCR was positive. So really important, if you've got symptoms and you're vulnerable, if you have PCR available to you and you don't have a rat test handy, do go and get that PCR test. If you're vulnerable, you've been around people with COVID and you get a positive rat test, start seeking out those antivirals, and then you could confirm your result with PCR. look, if you're not likely to need treatment and you're not working in a very high risk area, those RAT tests are probably good enough for the time being. And so if it's negative, stay home until you're well is the key message, because it doesn't matter whether it's COVID, whether it's RSV, whether it's flu. You can make other people quite unwell if you go about sharing your germs. So staying home if you're sick until you're recovered is probably the best advice we can give anyone at the moment.
Thank you, Dr. Jan. Dr. Valerie, there's tests for, you can test for a RAT and a PCR for COVID. What is the best thing to know that if you have monkeypox, do you just go to your GP? And I guess you've just emphasizing that for the media to share with the communities.
Sure. So I think if you suspect that you may have monkeypox, and as I say at the moment, it's just not everybody with just a sore, because it is still very much focused in gay and bisexual and men who have sex with men. However, and most of those are travellers, so that they would be people who come back from overseas, and then see that they have a lesion that they're unfamiliar with and don't know what they have. The most important thing is obviously to be properly checked out. However, it is good to call your GP or sexual health clinic in advance so that they are ready. So they are also protected. Of course, most people, all healthcare workers are protected for COVID these days, but it is still an extra preparation to potentially isolate an individual who comes into a practice or a sexual health clinic. And to ensure that all the staff are wearing appropriate protective wear. So really, it is really important to get checked out. And at that review, during the examination, there will be samples taken of the lesion. If there's more than one, then more than one sample, and they will be taken to Westmead Hospital. So it is now centrally. It can also be done at Seals, which is in the Randwick, southeastern Sydney area. But essentially, monkeypox is still, because it's not very common. It is a test that's been centralised in our most specialised laboratory at Westmead Hospital. And the result of that is available within 24 hours of that individual. What's also really important with monkeypox is, just like with COVID, particularly in the initial days of COVID, is to understand any contacts that may have been also exposed. So that case, if they have monkeypox or suspected monkeypox, would expect a phone call from their public health unit to understand how they may have acquired it, but also if there are other people who need to be contacted for potentially exposure, and those individuals are now also eligible to receive the monkeypox vaccine. So it's important that we understand very quickly, both for your own good, for your own health, but also for your potential contacts.
Thank you, Dr.
So just like with COVID, we're very, very discreet when we're doing that contact tracing. Absolutely. And so people shouldn't be worried that there'll be any stigma associated with it, or that we'd be naming who the person was who they might have been in contact with. So that discretion that we could assure the community with COVID goes doubly for monkeypox.
Thank you for reminding me
to
actually stress that, because I think that is a really key, important aspect to monkeypox in particular. Absolutely, total privacy and confident, people can be confident that their privacy is very well maintained.
Thank you, Dr. Valerie, and thank you, Dr. Jan. In terms of it spreading widely, now, it started just a few months ago when the first cases came out. What are we to expect?
You're good. It's I think a lot of us have learned with COVID that it's probably better not to predict everything, because we can't predict what can happen. However, usually what can happen with this sort of infection is that it builds up to a peak and then will decline. And that's what's going to happen in some countries. Obviously, when you introduce vaccine and other precautionary measures, you reduce the likelihood of transmission very quickly. And that's why it's really important that people are aware of how to protect themselves, and also if they're eligible to take the vaccine. What will happen? I don't know. We will try and make sure that local transmission is reduced to a minimum, and that helps. That's why we need to understand when people do come forward very early, so that they're diagnosed early, and those who benefit from the vaccine get the vaccine early. So hopefully we're not in a situation where we're going to get a lot of cases, but I would be the last person to predict what's going to happen with any infectious diseases these days.
Thank you. We just wanted to remind everyone, if there's any more questions that you'd like to ask Dr. Valerie and Dr. Jan. Dr. Valerie, in terms of what you've seen in evidence with regards to having vaccination when you leave the country, is that very important? If you are planning to travel, it would be good for the communities to get vaccinated before they leave.
So communities to get vaccinated. So certainly if you are a gay man or bisexual man, or a man who has sex with men and are likely to have casual partners while you're abroad, then you should definitely contact your sexual health clinic to discuss getting the vaccine. Or actually you can even go onto the ACON website and register your interest. If you're not a gay man, bisexual, or a man who has sex with men, then at this stage, this is not for you. It is not, we're not saying the vaccine is available to everybody, because it's not everybody is at risk of monkeypox.
Thank you. And I think that's important to emphasize it to communities as well. Dr. Jan, in terms of booster shots, still important for us to get vaccinated for COVID-19, and important to keep promoting that to communities.
Absolutely. And I think it's really important that, I think whenever we see, we're on the downward curve, everyone really feels, this sense of relief. It's all over for now. But, the cases are still coming in. There are people who are still being hospitalised, and there will be for the next 2 or 3 weeks with this current wave. So it's still important. That booster shot will start giving you protection within a week, seeing as that you've already had your primary course. So it really can help prevent. And people who've had COVID, now that once they're 3 months since they had that COVID, so people who had COVID earlier in this year and said, I'll be right, we're finding that people who had COVID earlier in the year are still able to get sick with this one. And these are the people who are saying, oh my goodness, I've got COVID for the second time. And those vaccines really do work, and they help, more recent vaccination can also help prevent transmission in households. It can help prevent, getting sick at all. So I think it's really important that we're not completely defeatist about the COVID vaccines. They're doing a really good job. Some people will still get sick. Some people will still feel completely rotten. But the number of people who are really unwell and needing to go to hospital, needing to go to ICU decreases significantly.
Thank you, Dr. Jan. And there are cases where people have had COVID 2 and 3 times. And how could they, what is your advice for communities to keep staying safe, and for people not to have the same instances for other people?
Look, I think people sometimes feel, look, I've had it. It wasn't that bad. It doesn't matter if I get it again. But what we do know is that it's not always less severe the second time around. So there's different information for different people. Some people seem to be fine the second time. Some people are much sicker the second time. So you can't have a guarantee that you're going to be the one who's going to be fine. So vaccination actually gives much more predictable immunity, because some people only have a very mild illness and don't seem to have that long-lasting immunity. Other people, they had it back in the day and they've never got sick again. So, you know, there's individual factors as well. I do see a lot of people saying, you know, natural immunity, I'm going to be fantastic. We do have to remember that our incredibly strong immune system is sometimes what can make us really sick with COVID. So it's not naturally saying I've got a strong immune system, I'm going to be fine. Sometimes our immune system overreacts to COVID, and that's what can make us really sick as well. So it's important that we get those booster doses, because that we're less likely to get that overreactive immune system as well. And that's one of the reasons why getting kids vaccinated is important, because they do tend to get that inflammatory syndrome more so than even adults. And so that's why vaccination of school-age children is really important. They don't always get sick from COVID itself, but they do sometimes get this post-COVID inflammatory syndrome.
Thank you, Dr. Jan. And we've run out of time, but one final question about masking. Some states are masking up to stay safe against COVID. Comments on that?
Oh, look, it's really important. I think, you know, we've had the chief health officer, we've had the chief medical officer out. And it's important to remember that wearing a mask protects you, so you're far less likely to be able to breathe in somebody else's virus, whichever virus it might be, and also helps protect others. If you are brewing COVID, if you're brewing some other infections, you don't know it, and you can be infectious before you get those first symptoms. So just by wearing a mask indoors, you can help protect other people. We're not wearing it in the studio at the moment because we're communicating, and it's important that people can actually see our lips move. But as soon as we're off air, the mask goes back on and stays on while we're indoors with other people. And that's simply because we're looking after each other. And we've had very few transmission events here at work when we've been wearing our masks together. It's not completely foolproof, but it really does help reduce the risk.
Thank you so much, Dr. Jan. And in some festivals that's happening across the state, people are, Multicultural New South Wales will be sharing masks around for communities as well in rat tests. So I think that's really important. Dr. Valerie, you're wearing your mask. So for monkeypox and other communicable diseases, I think that it's important that we have this habit already in place.
Absolutely.
Dr. Valerie, thank you so much for joining us. Any last words and any key messages you'd like to emphasize for the media and communities who are joined today?
No, I think it's important to keep up. I mean, this is a changing situation, and there's always an update and media releases. So regularly look at the New South Wales media releases and website for any updates. And you know, I think Jan said it, I think there's a lot of precautions that we can take around respiratory infections, and a mask is certainly a very good one, particularly in public transport.
Thank you so much, Dr. Valerie, for joining us. And Dr. Jan, there's a last question for you by Russell Anderson. Are there more risks for people who have had COVID twice with long-term COVID, such as higher cardiovascular disease?
Look, we know that people who've had COVID are more likely to have a heart attack in the next 12 months, more likely to have a stroke in the next 12 months, more likely to have a clot form in their lung or in their leg. So there is, each time you get COVID, there is that running the gauntlet again. For some people, they'll be okay, but for other people, it can actually increase that risk. So the best thing to do is to try and avoid it. It's not inevitable that you will have COVID, and wearing a mask and keeping up to date are two very good ways of trying to make sure that we don't share COVID with each other. Because I think that's one of the things, you know, we've got to really remember that me wearing a mask doesn't just help me, it also helps protect you, and you wearing a mask help protect me as well as you. So it's a thing that we can do to show our respect and kindness to each other as a community. And I think we need to keep showing that kindness and respect in the coming weeks.
Thank you so much, Dr. Jan. And there you have it. That's Dr. Jan, Senior Medical Advisor for New South Wales Health, and Dr. Valerie Delpech, Communicable Diseases Branch for Health Protection New South Wales. And I'm Jesusa, Helaratne, Deputy Director in the Multicultural Health Communication Service. And on behalf of New South Wales Health, Ministry of Health and Multicultural New South Wales, would like to thank you for joining us. We'll see you again in the next fortnight. Our next online conference is on the 24th of August and the 24th of August, and focus on health issues related to travel for children and adults. Same time, same link, 4:30 4 to 4:30. If there are other health topics you would like us to feature on this forum that are relevant for your communities, please let us know. The recording of this briefing will be available on the New South Wales Multicultural Health Communications Service website, and we'll send them through to you as well. Thank you very much for joining us, Dr. Valerie, Dr. Jan, and may you all stay safe. Take care.